contents. These are all the contents that we are going to cover in this presentation. This is the abstract. So, abstract includes the introduction, objective, methodology, result, and conclusion. So, as for the introduction, so as you know that the infertility which is associated with PCOS is a major cause of concern in present generation among the reproductive age group. This case report is on a fertile couple who had not been able to conceive since 11 years. So objective is, there are three main objectives. That is, there is in short, regular ovulation, healthy pregnancy, and a successful childbirth. So the methodology we are using is that here we are presenting a case of a 32-year-old female who had menstrual irregularity since past 9 years. And there is itching on vagina, there is abdominal vaginal discharge, and painful intercourse. So this case was diagnosed with primary infertility, which is associated with PCOS. So from Ayurvedic perspective, we can say that this condition could be considered as Bhardwaj, that is infertility, and which is associated with Nashta Artha, that is amenorrhea. So treatment includes both the perspective, that is Shodhan and Shaman therapies. So as for the result, I will just give a gist of the result. That is, during the treatment period, she lost 20 kg of weight and regained regular menstruation thereafter. And the big thing is that she was able to conceive within the 8 months of treatment. So she was not able to conceive like 11 years, so past 11 years, but within 8 months she was able to conceive, and she delivered a healthy baby girl. So conclusion is that this case report shows an insight into systemic learning, that how to manage primary infertility associated with PCOS effectively through Ayurvedic treatment modalities. So now I would like to invite you. Since 11 years they are trying. So here the definition of infertility is what? The person is unable to conceive after 1 year of uninterrupted intercourse of reasonable frequency. So the infertility is of two types basically. One is the primary infertility and second is secondary infertility. So anyone can tell me from the secondary, like, do you know what is primary infertility or secondary infertility? The basic difference. Okay, so I'm telling you, the primary infertility is the one like the patient is never conceived before. That is the primary infertility. And the secondary infertility, once it indicates the previous pregnancy, but now she is not able to conceive. That is secondary infertility. Okay. So this is the basic difference between primary and secondary infertility. Now, since here infertility is one of the predominant health issue faced by the married couple nowadays, and it is common in 10 to 15% of the couples. Now, as per current statistic, the male infertility problem constitutes 30 to 40%, female infertility 40 to 55%. Both are responsible in 10% of cases and 10% are unexplained. Now, according to FIGO, the FIGO is termed like International Federation of Gynecology and Obstetrics. According to that, there are so many causes of infertility in the female, and it can be divided into some ovarian factors and other factors. So, among ovarian factors, first is the ovarian dysfunction, and second is anovulatory cause of infertility. There are so many causes, but here we are dealing with the two factors, that is ovulatory dysfunction and anovulatory causes. So first is a critical evaluation on the female infertility show that ovulatory factors contribute almost 30 to 40% of case. So I'm saying now the ovarian factor, the one is the what? Ovulatory dysfunction. So among 30 to 40% fall in this ovarian dysfunction. And the second one is anovulatory function, like anovulatory cause. That will be, the PCOS is the major cause for this one, anovulatory causes. And then second is introduction to PCOS. You can see the diagram. The one side is, we are showing the normal ovary, and another side the polycystic ovary. The polycystic ovary means, everyone knows the poly means many, and there are so many cysts in the ovary. Like it should be greater than or equal to 12 number of follicles in an ovary, and it should be arranged periphery like a necklace type of pattern. That is said to be the polycystic ovary. Now for the diagnosis of the PCOS, it is Now the further information will be presented. So now moving on to the patient information OPD of home clinic with a complaint of inability to conceive even after 11 years of regular unprotected sexual life. So because this is a case of primary infertility, so the parameters of both the partner, that is male and female, were taken. So the semen parameters of husband were found to be within the normal limits. But the wife, whose age is 32 years, had menstrual irregularities since past 9 years, and the menstrual history of the patient shows 6 days duration with an interval of 6 to 7 months between the next cycle. So like there are menses for 6 days, and after for 6 to 7 days there were no menses. For months, 6 to 7 months there were no menses, and again this cycle repeated. So for treatment, they already, before coming to Ayurveda, they already underwent 10 years of hormonal treatment and IUI, that is intra-uterine insemination twice. So rapid weight gain observed during this time period, and at their first OP visit, her last LMP was 10/6/2018, and it was of course due to hormone-induced withdrawal bleeding with a duration of 6 days. So now this is basically the timeline of the patient. So you can see in 2012 she took treatment from the modern medicine, and then in 2016 she underwent IUI, which failed. So she sees the treatment for 2.5 years. She didn't take any treatment. But then in 2018 she came to Ayurveda for taking the treatment, and these were the parameters, her parameters during that time. So you can see there were irregular cycles, body weight was 95 kg, so BMI is so high, and there were polycystic ovaries, and the endometrial thickness is 7.5 mm. But then from 2019 she took Panchkarma treatments, other treatments we are going to mention further. So after that, you can see in just few months only, she reduced weight to 75 kg, and then even her thickness, endometrial thickness also increased. And then in 2019 only, her urine pregnancy test came positive, and she conceived with a healthy female baby of 3.26 kg. So now, Ravina. Now, what are the clinical findings we get in that patient? The patient was obese with a body weight of 95 kg, and the BMI of the patient is 34.89. So, can anyone tell me the range of the normal BMI?
18 to 24 kg.
What?
18.5 to 24.
Yeah, 18.45 to 24.9. That is the normal range. The person should lie, according to the weight and the height, the person should lie on that range, and based on the specific weight and the height. But here, the BMI of that particular person is so high, that is 34.89, and the person should fall under, the obese category. And further, the obesity is further classified into the 3 classes, like class 1 obesity, class 2, class 3, and this person was fall under the class 1 obesity. And on physical examination, we get the acanthosis nigricans on the neck. See, there are so many pathology in the pathophysiology of the PCOS. So one is the obesity and insulin resistance. So by that only the person become insulin resistant and develop this acanthosis nigricans. That is, the skin gets thickened and pigmented, and mainly that can be seen on the nape of the neck, axilla, inner thigh, and the groin region. And the second one is hirsutism, that is with the prominent hair growth on the chin and the upper lip. This is due to the high androgen level. We see that previously we see, right, the diagnosis criteria, the high androgen level, that is hyperandrogenism. And on the per vaginal and per speculum examination, we get clitoromegaly, bulky uterus, eroded cervix, abnormal vaginal discharge. And on USG report, we showed both the ovaries with polycystic morphology and 12 cc volume of each ovary. For that one, the ovarian volume, it should be greater than 3 cc for that criteria. And the person is having 12 cc volume, the ovarian volume. And the uterus is measured at 75 long, 34 is compared to 38 thickness, and anti-vertex. So the diagnosis, there are some parameters for the Bandhatva associated with Nashta Ardha. The dosha, that is, it is Kapha and Vata Pradhan. Then Dusha, it is Ras Rakt Mamsa Meda. Shota involved is Rasavaha, Raktavaha, Mamsavaha, Medovaha, and Artavaha due to the Avran to the Artavaha Shotas. And Shota Dushti is Sangha and Granthi. Now therapy. So for therapeutic interventions, first we did Shaman as a Purva Karma. The Purva Karma is before the main therapy, that is the Shodhan therapy. So here the combination of Chiru-Vilvadi Quat and Vaishvanara Churna was given. So as for Chiru-Vilvadi Quat, the main ingredients were like Puti Karanj or Chitrak or Haritaki, which all have Deepak action. So here the action is Vat Kapha Shaman, Deepan, elevating the Munda Vat. So next is Nirbhudyadi Kashai, Triphala Gubi. Their action is Kapha Shaman, Krimi Nashan. As Nirbhuti itself is a creamy hara drug, as well as this Kashai contains Vidari. It contains Vidals, which is a like kind of best cleaner drug. And so as a result, the cough might have been pacified and thus the pruritus and abnormal vaginal discharge diminished. So as for Anabhedi Sindur, there is the action of Anabhedi Sindur is Chedan, Lekhan, Vat Kapha Shaman with a specific action that is Raja Pravartak, which given with Jambeer Saurus, it's like lemon juice we can say. So as Sahapan, it becomes Deepan, Anuloman and also induces the bleeding. So the main purpose of giving Anabhedi Sindur is Raja Pravartak, as it will help in menses. So these are the main approaches, that is Deepan, Pachan, Anuloman, Lekhan, Raja Pravartak before giving the Shodhan therapy. Along with these medicines, these are the doses. So along with these, there are some specific advices which were given, like less oily, less spicy and pure vegetarian diet. There was absolute restriction for deep fried food articles and regular exercise for a period of 30 minutes and regular walking for a period of 45 minutes, which patient followed. So now moving on to Shodhan. Now for the Shodhan treatment, first we start with the Udvartan and Takrapan. Why we are starting with the Udvartan and Takrapan is because we see the patient is having kapha medudushti is very much. In that patient, the kapha, because she is very obese, like the BMI is also high, and the disease itself is a kapha vata pradhan. So that's why we first start with the Udvartan and Takrapan by Vara Churn, that is also known as Triphala Churn, for 9 days a day motion. Udvartan, we know why we do Udvartan. There is one shloka for the Udvartan, which is very important. Can anyone tell me? Stand and say it loud.
Udvartanam Kapaharam Medsha Pravilayanam Strikaranam Manganam
Strikaranam Manganam
Prasadam.
So that's why the first line itself indicate why we are doing Udvartan, because Udvartan is Kapha Hara and Medrasa Pravilayanam. It will do the liquefaction of the Medha Dhatu, which is very high in that patient. Then we proceed with the Sneha Pan with Sarshapa Tela, and Sarshapa Tela is also a very ideal medicine in case of Kapha Vata predominance. That's why, and we do, here the duration is mentioned, and after that time only we get the Samyak Lakshan of that particular therapies. Then Abhyanga, Dhanvantaram Telam, by the Dhanvantaram Telam, then Utkleshna by cooked masha as a food. For 1 day we advise that patient, and then Madan, like Vaman, for the Vaman, we are doing with the Madan Kalpa and Yashti Madhu Fand, and we do Vaman for 1 day, and this is the remarked feature of the Pitta Darshanat. Like Vaman we perform for Kapha, but when we stop Vamana, that is Pitta Darshanat Vamanam. And then Anuvarsan is Pipilyadi Tela for 5 days, and Lekhan Basti with Arindamula Quat, Dhanyamula, Pipilyadi Telam with Shata Pushpa and Sarshapa as a Kalpam and Sankhava. These are classical formulation mentioned here. These are mentioned in Ayurvedic classic also, these, for this Bandhyatva. And Uttar Basti is Mahanarayan Telam with Kalyan Kshara for 3 days. This is the Uttar Basti, and this the procedure is shown, that is Udvartan. So what are the outcome and follow-up? After the treatment, the body weight of the patient reduces to 75 kg, which was earlier is 95 kg, and the BMI was found to be 27.43. It's not lying in the normal range, but it's not obese also. Her menstrual cycle frequency improved substantially. On her speculum examination, it was observed that abnormal vaginal discharge and other visible changes due to cervicitis reduced considerably. Now these are the same formulation it is mentioned here, and some like the indication of these formulation is mentioned. We just go through this now discussion. So now we'll just discuss the whole case report. So here the diagnosis was confirmed as primary infertility associated with PCOS. So according to Ayurveda, this disease is Bandhyatva, that is infertility, due to Nashta Artha, that is amenorrhea. So where Avran of Artha Bahasrodhas become the chief positive factor. So here what was the Nidan that might be a vyayam, that is living the sedentary lifestyle, or intake of excess abhishandi ahar leading to kapha, meda, dushti and srota rodha. So here the movement of vata, especially the upper vata, got obstructed by the increased kapha, which in turn obstructed the natural functioning of vata. So according to Ayurveda, the main way to treat any disease is disintegration of samprapti. So here that's what the author did. So site of origin of this disease is first, but the specific site of manifestation is garbhashraya, that is uterus. So the ultimate aim of the treatment was to release the obstructed vata and to enable the normal functioning and in the coast, especially in the garbhashraya. So now again after the treatment, so when the UPT was done, it was suggested after a week of absence of menses and the result was found to be positive, and she delivered a female baby on 8/3/2020 with LSSC, that is lower segment caesarean section. So through the Ayurvedic intervention, it took a total of 8 months to get the positive result, whereas she was trying for like past 11 years to conceive. And now while she conceived, her date of LMP was 22/6/2019. And the successful outcome in the present case signifies that the relevance of logical selection of medicines according to the stage and judicious combination of internal medicines, procedures, diet and regimen for the complete cure of the disease. So now I'll conclude the session with that this case report shows an insight into systemic learning of how to manage primary infertility, which is associated with PCOS effectively through Ayurvedic treatment modalities. And the result obtained in this single case study is encouraging, and the protocol followed here may be subjected for trial in larger samples. These are all the references that the author took, and that's all. Thank you.
With them, they nicely presented the paper. Now the second part is the discussion part. So before that, I would like to say thank you to Dr. Abhishek sir and Dr. Alok sir for joining us. So sir,
welcome our new members. पता भी नहीं कि जनरल से लगता है, but slowly you will know it. So here what we discuss something which is related to clinics, and certain faculty members also come, and if you have any question about that, we can discuss here also. It is informal type of education which we normally have 15 once in a 15 day. Okay. So अभी मेरा रोल क्या रहता है? My role is very simple because I am not expert of this subject. So my role is to just review the paper. Normally we are taking paper from journal articles. So उस पेपर में वो पेपर कितने अच्छी क्वालिटी के ऊपर इतना काम करना मेरा पार्ट है. Then if question arises, the experts will give the answer. So here we have many experts are present. Here there is some anatomy part is also involved, some gynae is also involved, some panchkarma is also involved, some surgery. So all of us are here. So if questions are there, it will be very nice. So what I have to do, I have to review the paper. So you can see, first of all, it was a case report. So older people already know what is case report. Case report is single patient only. So nothing too much is there. So there we have to define about the patient profile. Yes, patient profile was clearly defined in the paper. Then clinical findings previous and present were defined. So it was correct. Then they have given about something about related to or we are following about what these things are going to be called in Ayurveda. So that Bandharto, Nashtarto and Kapha Meda Drishti, and she has already clearly said PCOS का directly कोई synonym नहीं है अपने पास. Treatment protocol, there were many phases were there, like first phase, second phase, third. So first is as we know पूर्वकर्म, that is preparatory phase. तो patient को prepare किया गया किसके लिए कि वो और दूसरे treatment protocol को समाह कर सके अपने अंदर. तो वो था preparatory, तो दीपन, पाचन, अनुलोमन, what they have already discussed. Then there is the protocol 2, that is purification phase. So here you can understand this is not a single treatment. This is a type of protocol. This whole thing what they have discussed is the protocol. So step by step you have to follow it to get the proper result. So you can see there were trying therapy, then there were irrigation, then therapeutic emesis, purgation and ultimately enema was also given. That is pasti is also given. So विश्व जो हम परिकर्म बोलते हैं लगभग सभी कुछ इन्होंने इसमें कर दिया है. Then specialized intervention was उत्तर बस्ती. So उत्तर बस्ती पे भी सर मैं कुछ अलग से डिस्कस करेंगे. Why उत्तर बस्ती? So good in infertility of female patients. Then clinical outcome, what was basic outcome here? It was that is a rapid reduction of weight. At least 20 kg weight is lost. Then merged to conception. 11 years से वो infertile couples थे. Within 8 months they have got fertility. That is conceive कर दिया. And birth weight भी देखो एक normal से थोड़ा सा ज़्यादा ही समझा जाएगा Indian condition के साथ है. Is 3.26. मतलब healthy baby was there. So scientific analysis, if we talk about paper specifically, so documentation is proper, that is comprehensive documentation has been done here. क्योंकि पहले तो मॉडर्न मेडिसिन के यहाँ ट्रीटमेंट करा के लाया, फिर बीच में उसने आईयू कराया और फिर रोका, तो सब कुछ एक टाइमलाइन में हमको दिखा। तो इट मींस डॉक्यूमेंटेशन वाज प्रॉपर, सिस्टमैटिक थेरापेटिक अप्रोच हियर, प्रिपरेटरी फेज, देन मेन फेज, देन आउटकम फेज, एवरीथिंग इज देयर। देन ऑब्जेक्टिव पैरामीटर्स वर देयर व्हिच कैन बी चेक्ड। तो जो हमारा BMI कम हुआ, वेट लॉस हुआ, फॉलिकुलर डेवलपमेंट लाइक एंडोमेट्रियस का ब्रेथ बढ़ा और अल्टीमेटली जो रिजल्ट चाहिए था वो मिला, दैट इज प्रेगनेंसी। Then integration of diagnostic modalities, we have used different diagnostic modalities, whatever modern modalities like USG and all the things we have used like. But as we say, nothing is perfect, so there are some limitations. So first of all limitation is this is the case report. Case report means only on single patient. तो जरूरी नहीं कि सब कुछ follow होगा, we need more studies. There can be confounding variables. Confounding variable means that these are present but not taken in the study. लाइक ऐसा भी हो सकता है कि केवल वेट लॉस से ही हो गया हो, ट्रीटमेंट का कोई फैक्टर ही ना लगा ले, 20 kg वेट लॉस इज टू मच। ओके, सो दिस मे बी ए कंफाउंडिंग फैक्टर, मींस मेडिसिन ने ही काम किया कि केवल वेट लॉस ने काम किया, इट इज स्टिल कंफर्म नहीं हो सकता है। देन देयर इज सम मैकेनिकल अंडरस्टैंडिंग, राइट, वी हैव टू अंडरस्टैंड सम बायोकेमिकल डेटा। रिप्रोडक्टिव challenges means is this protocol applicable to everyone, so it has to be checked. Plus it is always a publication bias in case report अनुसार ज्यादातर पॉजिटिव आउटकम का ही प्रिंट होता है, नेगेटिव का होता ही नहीं, तो इट कैन बी आल्सो बी अ publication bias. So what we can take from here, there is a clinical significance, yes, result positive है तो clinically significant है. Then there can be further recommendations like prospective RCTs हो सकते हैं. We'll discuss what is RCT to new student, and there are different protocols which can be modulated. अब इसमें मुझे ही समझ में आया पढ़ते पढ़ते कि प्रकृति से related protocol change भी हो सकता है. So these are the things which we can modulate in future also. If we want to, the conclusion is that yeah, paper is okay because paper is coming from the PubMed. तो मोस्टली PubMed में पेपर ज्यादातर ठीक ही होता है. But these are criteria how we can give markings also. So these are some points from my side. So that's all from my side.
पहले तो बता
जैसे शोधन हुआ तो जैसे इधर पर वात और कफ का इन्वॉल्वमेंट था, तो कफ ने आवरण किया तो वात भी विकृत हुआ होगा। तो सर यहाँ पहले वमन किया गया, विरेचन, उसके बाद वस्ती। तो सर क्या पहले प्रधान दोष को ट्रीट नहीं किया जाता, जैसे वमन हो गया, कफ का ट्रीटमेंट हो गया, उसके बाद वस्ती नहीं कर सकते, मतलब विरेचन बीच में बाद में भी कर सकते थे?
Actually, what we have used in what I find, we have made a total protocol of purification. Okay, हम वमन के बाद भी वस्ती कर सकते हैं, डायरेक्टली we can go forward. But वमन के बाद विरेचन करा के अगर वस्ती करते ना, then it always become better. Okay, because क्या होता है ना, अभी तुम स्थान देखोगे तो इसमें क्या है, मतलब मेन अगर देखोगे गर्भाशय इंक्लूडेड है. ओके, सो पहले अगर हम वमन कराते हैं, उसके बाद पित्त का विरेचन कराने के बाद अगर वस्ती देते हैं, ऑलवेज दैट मींस प्रूफ ऑलवेज बेटर. बट इसमें मैं, दिस इज फ्रॉम माय साइड व्हाट आई वांट टू टेल, इसमें जो स्नेहपान के लिए शर्षप तेल यूज किया गया ना, प्रैक्टिकली दैट इज नॉट वेरी मींस इजी टू यूज. जो लोग स्नेहपान करते हैं दे विल अंडरस्टैंड. टेकिंग स्नेहपान इटसेल्फ इज अ वेरी डिफिकल्ट थिंग. So, और वो भी शर्षप तेल से स्नेहपान करना is little bit difficult. So practically when we do, we can even use तिल तेल also. इसमें क्या है, they have first tried to do संप्राप्ति विघटन. ठीक है, तो वात का दो तरह से वात विशेषण हो सकता है. One is आवरणजन्य, one is क्षयजन्य. And if you see the clinical picture, they have very nicely told it. This is आवरणजन्य because कफ मेदा is elevated. All features what you tell. So what you see here is kapha meda increasing. Person is obese, then there is abnormal vaginal discharges are there. Okay, so everything is that, and along with that you see the patient is having means all amenorrhea, you can tell amenorrhea. Okay, so means Artava Shrav is a function of Apanvai. So that Apanvai function is impaired. Why? Because there is an avaran of kapha. So कफा का अगर हम क्लैरिफाई करना चाहते हैं, कफा के लिए द ट्रीटमेंट मोडालिटी बेस्ट इज इंशोधन, दैट इज वमन. ठीक है, बट विरेचन ऑल्सो इज अ ट्रीटमेंट प्रोटोकॉल फॉर कफा एंड वाता ऑल्सो. सो इधर हमको जो विरेचन देंगे that will further will have a synergistic effect, but not necessarily if the patient is not suitable. शायद अगर पेशेंट का condition was much more better, so they could go for Vaman also, then Virechan also. In all patients, we may not have the suitability to go for Virechan after Vaman, but this patient, as it is a single case report, the patient may be suitable. Patient का शायद सत्व अच्छा था, बल अच्छा था, सब कुछ अच्छा था, so they could go for both of the procedures. Otherwise, you can go for Vaman also, and after that Vasti also. अगर पेशेंट मतलब वमन के लिए सुइटेबल नहीं होता तो इधर तुम वमन की जगह में विरेचन करा के भी बस्ती कर सकते हो. सो दैट टोटली डिपेंड्स ऑन द पेशेंट.
सर जैसे रोशन क्रिया शमन हो गया, लेकिन सर उसके साथ बात तो विकृत नहीं हो जाएगा सर?
नहीं. सी हियर दिस पंचकर्मा प्रिंसिपल्स आर लिटिल बिट डिफरेंट. देयर वी आर गिविंग स्नेहपाना से स्नेहन वी आर गिविंग, बात को शमन करने के लिए नहीं कर रहे हैं, हम कफ को बढ़ाने के लिए कर रहे हैं. ठीक है. और यहाँ जो वो लोग रुक्षण कर रहे हैं ना, वो कफ को कम करने के लिए नहीं कर रहे हैं, वो इसलिए रुक्षण करते हैं ताकि जो स्नेहपन हम देंगे उसका एब्जॉर्प्शन अच्छा हो. जो आम है ना, से हम लोग पहले दीपन पाचन करते हैं. दीपन पाचन से क्या होगा, आम का पाचन हो जाता है. उसके बाद भी जितना आम रह जाता है या स्रोतों में संग रह जाता है, उसको मीन्स कम डाउन करने के लिए हम लोग रुक्षण करते हैं. दिस रुक्षण इज नॉट डन फॉर प्रोलॉन्ग टाइम पीरियड, मे बी 2 days 3 days दे डू इट, सो दैट रुक्षण के बाद रुक्षण क्या करते हैं, तुम्हारे स्नेहन को मीन्स फैसिलिटेट करते हैं, उसको ज्यादा एब्जॉर्प्शन अच्छा करते हैं, इसलिए ही रुक्षण किया जाता है. ये रुक्षण वी आर नॉट प्लानिंग टू मीन्स प्लानिंग फॉर रिड्यूसिंग कफ, उसके लिए नहीं किया जाता. हाँ,
कांचना का यूज किया जा सकता है सर PCOS में?
बिल्कुल कर सकते हैं. See, Ayurveda is a beautiful science where with your own analysis, युक्ति से तुम कोई भी चिकित्सा कर सकते हो, and युक्ति से किया गया हर चिकित्सा will give you the result. But now what we see which treatment gives us the most benefit and we select it. ठीक है. So Kanchana अगर युक्ति में आता है Kanchana, तो you can obviously use it. Many people practically also they use Kanchana Guru in this.
We have to remember, age of patient is also very
Yes.
32 years only. ठीक है. अगर ये 40 क्रॉस होता तो चेंज हो जाता सब.
I think they have achieved so much weight loss because of that only.
Yes.
They did Vaman, so then Sansadan come, then Virechan, then Sansadan. So the patient was fasting for long time. So that's why they are achieving so much. Otherwise, 20 kilo weight loss is not easy to achieve in a single person.
Or it is not suitable for all patients.
Yes, any patient.
Because this is obese patient, so we could use Vaman.
But OH person feel very early the weakness, na?
Yes.
So, but they are that's why the process was very controlled, I think. But I have some question regarding the investigation. What investigation they did? Because I missed the initial part. Any cervidoscopy or something was there or not? USG. Or hormonal assay something they did or not? Because if you're saying PCOS, then we should see the hormonal status, what are the androgens level and all that. Then only we can say the PCOS.
Hyperprolactinemia.
Yeah. पेशेंट पेपर में मेंशन किया इन्होंने कि नहीं किया?
इसमें सिर्फ असाइनिंग सिम्टम्स
तो क्या ही पता चलेगा?
एंड ऑलरेडी वो 10 years पहले जब उन्होंने मॉडर्न लिया था पूरा ट्रीटमेंट, उस टाइम पे ही वाज ऑलरेडी डायग्नोस्ड विद PCOS, तो उन्होंने पेपर में ऐसे मेंशन किया.
10 साल पहले तो 10 साल में तो दुनिया बदल जाएगी. 10 साल में
तो पहले उन्होंने AMH कराया, लेकिन फिर नहीं कराया दोबारा.
क्योंकि आइडियली अगर हम देखें ना किसी पेपर को साइंटिफिक वे में, देन वी मस्ट सी द इन्वेस्टिगेशन एटलीस्ट. क्योंकि अगर हम PCOS टर्म दे रहे हैं तो PCOS इज नॉट ओनली द symptomatic can say na, symptoms may be some other thing because of
इसमें एक पूर्व कर्म में लिखा था उद्वर्तन प्लस तक्रपात, उद्वर्तन प्लस तक्रपात. तो सर इस केस में तक्रपान का क्या रोल है?
तक्र में वृक्ष होता है ना.
वही रुक्षण.
तक्र की प्रॉपर्टीज पढ़ो. तक्र दीपन करता है, रुक्षण करता है, तो इसीलिए दिया है।
There is a very common practice, okay, especially in Kerala, that जब हम लोग स्नेहपान कराते हैं ना, स्नेहन करते वही बोल रहे हैं, स्नेहन का मतलब जो बायो अवेलेबिलिटी है ना, उसको बढ़ाने के लिए उसके पहले हम लोग रुक्ष कर लेते हैं। तक्र रुक्ष होता है, त्रिफला भी रुक्ष होता है। So they mix trifala churna with takra and give it morning and evening twice daily, half an hour before. वो जस्ट रुक्षता को फिर तुम्हारे शरीर में अगर रुक्ष गुण ज्यादा होगा तो तुम्हारा स्नेह जब दोगे उसका एब्जॉर्प्शन ज्यादा होगा। तुम्हारी बॉडी में अगर ज्यादा क्या होता है, कोई मिट्टी का अगर पात्र है ना, वो बहुत ज्यादा ड्राई होगा तो तुम उसमें पानी डालोगे तो पानी को ज्यादा एब्जॉर्ब करेगा। उसमें अगर पहले से थोड़ा मतलब ह्यूमिड है, थोड़ा पानी है, देन इफ यू आर पोरिंग वाटर ओवर इट, देन पानी का एब्जॉर्प्शन नहीं हो पाएगा। सो स्रोत को थोड़ा रुक्ष कर लेने से उसके बाद जो हम लोग स्नेह डालते हैं ना, वो ज्यादा अच्छा पेनिट्रेट करता है, वही फैसिलिटेट करने के लिए। ठीक है,
स्नेहन करते किसलिए, ये तो आइडिया होगा ना, क्यों करते हैं स्नेह?
मतलब पूर्व कर्म है तो।
हाँ, क्यों करते हैं, इसका मतलब क्या है, क्या फायदा होता है?
दोषों को एक जगह कलेक्ट करना, पोस्ट करना।
दोषों को कलेक्ट करने के लिए, बल्कि दोषों की मोबिलिटी बढ़ाने के लिए। ये मानना है कि अगर दोस्त एक जगह दूसरी जाएंगे, अगर स्नेह अच्छा होगा तो इजिली वो मूव कर जाएंगे। ठीक है, तो वो अचीव करने के लिए, क्योंकि अल्टीमेट हमारा शोधन कर्म कर रहे हैं ना, अल्टीमेटली हमको दोषों को बाहर निकालना है। तो बाहर निकालने के लिए हमको पहले शाखा से स्रोतस में लाना पड़ेगा, स्रोतस से फिर हम बाहर निकाल सकते हैं। तो स्रोतस में लाने के लिए वो इनकी मोबिलिटी बढ़े, इसलिए हम स्नेहन करते हैं। तो अगर स्नेहन अच्छे से नहीं किया तो दोस्त अच्छे से मोबाइल नहीं होगा, तुम्हारा शोधन परफेक्टली नहीं हो पाएगा। ठीक है, इस अब वो भी क्योंकि दो शोधन का भी स्नेह में कोई इसलिए कोई परफेक्ट क्राइटेरिया नहीं है कि इतना ही लीटर हर पेशेंट को देना है। पेशेंट टू पेशेंट को वेरी करे, किसी का 3 दिन में अच्छे से स्नेह हो जाएगा, सारे स्नेह पांच लक्षण दिखने लगे, इसका मतलब दो सभी मोबाइल हो सकते हैं अभी आप शोधन के लिए जाए। तो वो मोबिलिटी अचीव करने के लिए हम पहले स्नेह प्रॉपर होना पड़ेगा, उसके लिए थोड़ा सा रुक्ष कर देंगे तो स्नेह एसिमिलेट कर सकते।
Let us suppose that second pregnancy is conceived. In future में फिर से PCOS के reoccurrence होने के chances है या नहीं, या उसके बाद second अगर further lady want to conceive further,
बताइए इस केस में PCOS था भी कि नहीं?
तो सर उसको कुछ diagnosis कर सकते हैं सर?
क्योंकि USG रिपोर्ट में क्या दिया है, USG रिपोर्ट की एंडोमेट्रियस की फाइंडिंग क्या है, अगर उसमें है क्या कोई कॉज तो उसमें क्योंकि PCOS है ना, तो पॉलीसिस्टिक बहुत सारी सिस्ट होनी चाहिए ना, दिख रही है
कितना एमएम होने पर पॉलीसिस्ट होता है?
सिस्ट है, कितनी सिस्ट है, एक ही तो सिस्ट है तो नॉर्मल है रहती है। 32 एज में तो सिस्ट बन ही जाएंगे, क्योंकि जो ओवुलेशन होता है उसके बाद यहीं पे सिस्ट डेवलप हो जाती है इजीली।
और बहुत बार यूएसजी पॉलीसिस्टिक फंडिंग करने के बाद 2-3 महीने के बाद करने से
डिसॉल्व हो जाती है। क्योंकि यहाँ पे ज्यादातर एंडोक्राइन सिस्टम इन्वॉल्व है, जो ग्लैंड्स इन्वॉल्व है, ग्लैंडुलर टिश्यू इन्वॉल्व है। जैसा इसका वादक का कहना है, काचनार इज अ वेरी गुड ड्रग इफ यू आर ट्रीटिंग एनी कंडीशन वेयर द ग्लैंडुलर टिश्यू इज इन्वॉल्व। काचनार हैज अ वेरी गुड इफेक्ट। हाँ,
Infertility here due to PCOS. There are various patients coming due to PCOS. Mainly, we can correlate with Artavshay in case of Ayurveda. Artavshay, what it is said that it is Yatha Uchit Kala Adarshan and Alpata and Yoni Veda. So there is one shloka regarding that. Obviously, they will know. So there mainly untimely and irregular menstrual period, they come with that. So I'm telling my own experience. So they come with irregular menstrual period. So mainly we confuse like oligomenorrhea and hypomenorrhea. Like scanty menstruation, that means it is hypomenorrhea, and oligomenorrhea with 35 days, more than 35 days of the time period of the menstrual cycle. So mainly Artavshay is that, and then Alpata. Alpata, why? Due to any gynecological disorders, mainly it is because of the Apan Vayu Drishti, as sir has said already. Apan Vayu Drishti, and mainly Artav is having Agniya character. Agneya character here, Pitta also can be Dushita. Pitta decreases. Okay, so Vata is Dushita upon Vayu mainly, and Pitta gets decreased, and maybe in case of obese patient, Kapha also gets Dushita. So Srota avrodh may be there. So there are various forms of patients which you will get in your practical. So mainly in case of my OPD, like PCOD, they come with many irregular periods and scanty menstruation and irregular this one. So as a result of this, what happens is that anovulation will be there, avija. So avija will be there, and also I wanted to tell about this one, androgenic state. So in intrafollicular phase, what happens is that obviously you will know later, you will study in your classes also about the menstrual cycle. So in Graafian follicle, actually this is about Graafian follicle only. In the ovary, Graafian follicle is there. So what happens is that in case of PCOS, it gets arrested. It should be like 18 to 23 mm in diameter, the matured ovum. But what happens here is 2 to 9 mm. Only it grows up to 2 to 9 mm. Why? Because the follicles gets atretic. Why? Because of the androgenic state. Androgenic in the sense, there are two types, there are two hormones. Especially gonadotropin releasing hormone, which is situated, which is synthesized by the anterior pituitary gland, which is situated in the hypothalamus, the base of the brain. So anterior pituitary, what happens is that from there gonadotropin releasing hormone is secreted. What are the gonadotropic hormones? These are the LH and FSH. So LH, what happens is that here it gets elevated. And FSH, it doesn't get increased or decreased, but LH gets elevated. So there is a imbalance in the ratio of LH and FSH. So it will be more than 2:1. So what happens? So there is an imbalance. So and also there are various compartments. Suppose like hypothalamus and anterior pituitary. This is the one compartment. Second compartment, it will be in the ovary. In ovary, what happens is that androgen production, it will be more because LH is elevated and it will act in the ovary where theca cells. In the theca cells it will act, and then it will produce more androgens, androstenedione hormone, androstenedione, testosterone, dehydroepiandrosterone. This will get increased. So in normally what it was supposed to happen, there should be aromatization, but aromatization fails. Or default aromatization takes place. FSH converts these androgens to estradiol, but due to less FSH and elevated LH, there is an imbalance and more production of androgen. And I'm telling in short that androgen production is more in the ovary, and also adrenal gland, which also secretes androgens. So this all increases in the bloodstream, and also sex hormone binding globulin. This also gets decreased due to androgen, more androgen production. So as a result, free testosterone hormone, which should be only 1%. Free testosterone hormone should be only 1%, but here free testosterone hormone is increased due to androgen, excessive androgen, and also unbound estrogen is also present. So as a result, it becomes hyperandrogenic state. It should have been in intrafollicular level, it should have been estrogenic state it should have been, but it is a state of hyperandrogen. So that's why that answer was hyperandrogen. So continue the treatment, PCOS, and leading to anovulation, and also the other treatment protocols we can maintain. Okay, and mainly in our Ayurveda, first of all Agni Dipan should be done, and then Shodhan should be done, and also the Samshaman. And as we know that Basti is the Ardha Chikitsa, treatment of Vata. So the Uttar Basti is given mainly following all the Panchakarma treatments. So we can conclude with that. Thank you so much.
तुम्हें उस पर क्या प्रभाव पड़ेगा?
जैसे कि रिड्यूस हो गया था, इसमें आर्धक अग्निया है, तो जैसे
Please listen, and for the further question and regarding pathophysiology or regarding particular disease you want to know, then you can particularly message in the group over there. We will try to answer, and if you fail, then we can approach to our teacher for that. Thank you so much. Question will be for the first year. So जो भी आपने पेपर में सुना, जो सीखा, उससे रिलेटेड ही क्वेश्चन है, कुछ अलग क्वेश्चन नहीं है. जो पहले हाथ उठाएगा उसको मौका दिया जाएगा. तो फर्स्ट क्वेश्चन.
First I'll read the question completely, then you raise the hand. Okay. So, question number 1 for first prof. Infertility is defined as the ability to conceive after dash of uninterrupted intercourse of reasonable frequency. Option A 6 months above.
You, as instruction given, first listen to question and after question, you will be given the chance.
That's right answer. So, identify the condition. This picture you have to identify this condition. First option number A is hirsutism, second is acanthosis nigricans, third is Gadru, and fourth is none of the above.
You.
Now for the second prof.
The second prof, this first two question will be, next two question will be for you. So listen the question, and those who will be raising their hand first, they will be given the chance.
So first question is chief ingredient of Vaishnavar churn is amlaki, harikati, both A and B, and Google.
Okay, Dhaka.
Yes, that's the right answer.
Again, listen to instruction. Answer earlier, you not listening to this, you can answer nothing.
Now the second question for the second prof. How to calculate BMI, that is body mass index? It's weight in kg by height in centimeter, weight in gram by height in meter, weight in kg by height in meter, or both A and C.
So now,
Weight upon height is option C, but height in meter square.
now the remaining two questions. So for this question, there will be an opening. I mean, anyone can answer because as we are the part of the team, so anyone can answer from the first year, second year, and the final year. And chocolate is good.
The key feature of PCOS is polycystic ovary, anovulation, hyperandrogenism, or acanthosis nigricans. That
Polycystic ovary.
no, that's the wrong answer.
Anovulation.
No, that's also the wrong
Okay,
answer.
now this is the another rule after this condition. So when the two people already have answered, that question will be not given for the public, and the answer will be given by the committee, and they will be getting the chocolate.
Answer is C, that is hyperandrogenism. That is the key feature for features. All these are including the Rotterdam criteria, but this one is the key feature. So now the next question. Which formulation is used as Raja Pravarta? It's Tiruvalvadi Kwar, Vaishnavar Churn, Annavedi Sindhu, or Nirgundi Adi Kwar.
तुम्हारे बगल में डाला because those who have already given answer will be not given the chance. Option C. So with this we had completed our quiz round also. Now the most important part, because as you can see is the Chintan, Vimash, Chintan, Manan and Chintan. So now the next part is the discussion part. So whatever the doubts you have regarding the paper or any particular